Hello and welcome. My name is Csaba, and today I kindly ask you to join me for this presentation on family caregivers burnout with a special focus on lung cancer caregivers. Let me start on a personal note. In this picture, you can see my father, a lung cancer, and also who died of lung cancer at 49, and my mother, a lung cancer caregiver, still alive. This picture was taken in Budapest before the caregiving experience. So let's start from here. Now, actually, I am sitting in Cluj-Napoca in Romania, but I can tell you that caregivers in Europe are very similar in so many senses. Caregivers in Europe are a substantial but still anonymous and largely without identification group of persons who are actually dedicated to these caregiving responsibilities. According to a white paper by the European Cancer Patient Coalition, ECPC, and Eurocarers, carers in Europe who are informal and unpaid already provide 80% of care in Europe. While people with cancer are identified through their diagnosis, cancer carers most of the time remain largely anonymous, despite their clearly fundamental role they play in the healthcare pathway. Only a total of 39% of cancer carers interviewed by ECPC and Eurocarers describe themselves as carers or caretakers, which is a very central issue. A most recent survey from Eurocarers with the aim to map and examine the effect of the COVID-19 outbreak on informal carers' well-being, caregiving conditions, support networks, access to health and social services, working status, work-life balance and finances, technology use, and so many other factors. So with this aim, the survey showed that 60% of respondents say that caring has a negative effect on their health as caregivers, and they do not feel that during the COVID-19 they have been well valued by society. The pandemic has had the greatest negative effect on the following areas of life: social life and participation, quality of life, physical and mental well-being, and of course access to health and social services. Also, an increase in the amount of the medical and emotional support offered was emphasized by caregivers, and one of the most visible issues and the most trying and challenging issues was the use of modern technology, smartphones, social media, computers, tablets, all being used widely, extensively, intensively, almost all around the clock. Due to the outbreak of the COVID-19 pandemic, 20% of carers lost their jobs or had their working hours cut, and of course their income decreased in Europe. These are very important survey data and survey results. Now we will meet with a non-existent word, but a very painful reality. It's called caregivership, which I would say it's the multidimensional burden with the difficulty of care. So caregivership. Here I'm going to share with you most of the great research from the University of Miami, where actually Kim Young-mi and her devoted teams and research members actually have done extensive and very clear work on caregivership. So let's start on the physical level. Cancer caregiving is related to increased blood pressure. to the dysregulation of autonomic nervous system, to the dysregulation of the HPA axis, the stress axis, the hypothalamic pituitary axis. Also, immune changes and poor health-related behaviors are connected with cancer caregiving. Actually, to see the minimal and major impact, please take a close look to this slide, which is a proposed model of the impact of coping strategies of cancer caregivers on psychophysical indicators of burden. It's a very, very important system of understanding to start with, the physio and psychosocial correlates of cancer caregiving burden. Moving on, here we see a report from Macmillan. They say that 70% of cancer carers experience some form of emotional impact from caring. Almost 40% of spouse caregivers reported depressive symptoms in a range that is likely to be clinically significant, a prevalence that is almost twofold that of their ill partners. Twofold, right? So marital dissatisfaction was found to be an even more important contributor to depression than objective caregiving burden. Do remind that intimacy, sexuality, and marital dissatisfaction are closely correlated. Here we can see the frequency and difficulty in caregiving among spouses of individuals with cancer. Actually, here the study was on the role and the effects of adult attachment styles and gender. Please take a look at the side with attachment security graphics and make sure that we highlight that persons more likely to be ineffective caregivers of cancer patients can be identified by their attachment orientation. For example, anxiously attached individuals are likely to become self-preoccupied and provide insensitive caregiving. Moreover, anxiously attached individuals are prone to chronic grief after bereavement due to their fear of abandonment. So, attachment style is extremely important in caregiving experience. Physical and mental health trajectories of cancer patients and their caregivers should be studied closely and mutually together. Here we can see a dyadic investigation years after post-diagnosis, also from Professor Kim Young-mi. For both patients, we can see, and caregivers, poor mental health diagnosis posed significant risk to their physical health. Namely, distressed patients showed stagnated physical health recovery, and distressed caregivers showed accelerated physical health decline. Caregivers' physical health declined most noticeably among those reporting low mental health at diagnosis and whose patients reported low physical health at diagnosis. So there is a very strong interconnection of physical and psychological and of patient and caregivers in a dyadic investigation years after the diagnosis, the cancer diagnosis. Moving deeper into this issue, we can see here the depressive symptoms that predict cancer caregivers' physical health decline. This study at that point provided novel information regarding cancer caregivers' long-term physical health decline. Notably, only caregivers higher depressive symptoms, so only caregivers higher depressive symptoms predicted their accelerated physical health decline from 2 to 8 years following the patient's diagnosis. So, yes, depressive symptoms are core in the experience of caregivership. Here you will see two longitudinal studies, one after 5 and one after 8 years post-diagnosis among cancer caregivers. The focus is on depressive symptoms and quality of life. Depression is a long-term challenge for this population of caregivers. The first evidence that after 5 years, the initial diagnosis in the family, many family members who remain in an active caregiver role or who have been bereaved suffer from depressive symptoms, serious enough for concern. So, on a clinical level or close to a clinical level. So, these findings after 5 years highlight the importance of caregiving stress, distress, and social support early in the caregivership process. In the second study, it was that point the first evidence that family members who became bereaved by 8 years after the initial cancer diagnosis in the family suffer from poorer mental health and greater psychological distress years after the loss. So, bereaved or currently caregiving family members at the 8-year mark reported poorer mental health and greater distress than family members of survivors who were in remission. So, yes, 8 and 5 years post-diagnosis, depressive symptoms and quality of life are still a big challenge for cancer caregivers. Also, because we need a holistic issue and perspective, psychosocial and economic burdens in lung cancer caregivers should be tackled first. This is very problematic, stigma sensitive, and still very much hidden, especially in low resource countries like mine, where blame the game is the hack of the day. So, what we can see is that clinically elevated distress was reported up to 50% of lung cancer patients' family caregivers, and more than 35% reported negative physical health effects of caregiving. Lung cancer is a particularly distressing kind of cancer for persons affected by it, but also for family caregivers because of its high physical burden. Yes, because of the physical symptoms, the poor diagnosis most of the time, and the stigma, particularly when the patient persists in tobacco use after the cancer diagnosis. The family, and I would say the social environment of blaming the patient during times of illness can affect all of us, both the patient and the caregiver's depression especially. Blame or anger towards lung cancer patients may alter help-seeking behavior and reduce communication between the primary caregivers and patients. So it's very important. Don't blame the game. It's also very painful trying to coordinate everything. The majority of lung cancer caregivers, 74%, 3 out of 4 distressed family caregivers of lung cancer patient experienced one or more adverse economic or social changes, negative social or economic changes since the patient's illness. Extremely high. It is extremely high. This hardship occurred even though most caregivers were from the middle to upper class in the United States, and 92 had health insurance. So this was a highly well-insured category from an economical or financial perspective. Still, 74% experienced adverse economic or social changes during caregivership, during caring for lung cancer patients. Loss of the main source of the family income and disengagement from most social and leisure activities predicted greater caregiver stress. So don't forget, caregivers' distress, it's linked to the family income and also to social disengagement. The majority of the total economic burden experienced by informal caregivers of cancer patients, 91%, arose from the direct effort of providing informal care to the patient. So most of the economic burden, if we take the total, is experienced because of the direct effort of providing informal care to the lung cancer patient. So when we are talking about caregivers care, we should talk about caregivers or caregiving skills, resources, and interventions. Speaking about interventions, there is a small but very clear beneficial effect of these interventions. Overall, 65% of the studies led to positive and significant improvements in functioning of the informal carers and or of the patients for whom they provided care. Extremely important. 65%. When we are looking at the effect sizes, we can see that couple-based interventions have similar size effects to the patient-only or caregiver-only interventions. So nowadays, especially the increased use of telephones, smartphones, and also other web-based alternative modalities like Skype, Zoom, for intervention delivery is likely to be one of the solutions to the barriers of delivery of these interventions, which are clearly beneficial. So web-based interventions may reduce negative mood in caregivers of lung cancer patients. Also, there is data that web-based caregiver interventions, mHealth, eHealth, virtual health, are as effective as traditional intervention, although quality of some of the current web-based caregiver interventions are weak. So quality of them is weak, yes, in some cases. For conclusions, let me please quote the ECHO Essential Requirements for Quality Cancer Care. ECHO has a very special project, the European Cancer Organization, on essential requirements for quality cancer care, which are clearly enlisted also for caregivers. So, essential requirements. First, policymakers must formally recognize the role of carers and provide appropriate welfare programs, including paid carer leave, flexible work arrangements, financial compensation, and also pension rights. And I think we are getting closer and closer to this with the Europe's Beating Cancer Plan included. Second, carers must have access to programs including information, training, and very important psychological support, and must be included in a patient's care team. 3. Carers must be encouraged to identify themselves as carers. Do remember, less than 40% identify themselves as carers and take part in support programs, given that they do not identify with the term, with the situation most of the time, because there is, this kind of obligation, or this is perceived as an obligation, which is truly demanding on all levels, physical, social, financial, and in long term as well, as we have seen from the excellent research data. And fourth, at the European level, governments must adopt the New Start initiative for work and life balance for parents and for carers proposed by the European Commission. And please do take care and take a close look to the new safety and the new work requirements that are going to, take a closer steps and look to cancer and work issues in the following years in the European Union. Thank you so very much for your kind attention, and I warmly ask you to join and follow the Psycho-Oncology weekly discussions on Wonder Medical. So see you there and see you soon. Thank you very much.